important decision that the Supreme Court gave us on September 30th, 2 years ago. So they ruled unanimously that INSITE, which is Vancouver's safe injection program, will remain open despite attempts from the federal government to shut it down. They did so because they ruled that there was no evidence that safe injection compromises public safety, and there was ample evidence that it saved lives. And this is why we are here today, to continue the conversation about this with multiple stakeholders. So community partners, community members, people who live in the neighborhood, people who use drugs. It is important to mention as well that the people who are hosting us are dual, so the Drug User Advocacy League and CSCS, which is the Campaign for Safer Consumption site here in Ottawa. These two groups are both available to meet with any associations that are here today and interested to continue the conversation after today. I also want to mention that there is a speaker in the back. If people want to go in the backyard at any point, you can actually hear the speakers if it gets too crowded in here, or if you need to a cigarette and it's a supervised smoking area. Thank you, Mark, for the great joke. So we are here today. There are many different partners working together in harm reduction programs serving some of Ottawa's most vulnerable, and we have come together in this 2-year anniversary to promote the benefits of the safe injection programs and to demonstrate that there is a way to bring this important service to the City of Ottawa. One note before I continue and introduce our speakers. As many of you know, Rob Boyd was one of the main people organizing this event. His son Connor was one of the people who was killed tragically in the bus crash on the 18th. Understandably, he wasn't able to host this event today, but we did want to thank him for his leadership and let everyone know that he asked us to go ahead today. So how today is going to go is that we issued an invitation to everyone in our community, and we hoped in extending that invitation to be able to welcome those who are supporters, those who have concerns, and those who have not yet decided where they stand on this issue. And in doing so, we hope to spark a respectful dialogue about this important health initiative. As I was mentioning, we are hosting it here at the Crowd Study offices, and we thank Dr. Mark Tyndall and Dual and their people for hosting us. We do ask that everyone respects the rule of this office, which is that we have expectation that everyone will treat each other with courtesy and respect. This morning we have 4 amazing speakers who are going to speak briefly from different perspectives about supervised injection sites. We would ask you to hold all questions until the speakers have all spoken. We will have time for questions at the end of our presentations, and we invite everyone to take the time to dialogue with each other. Also, at the end of the presentations, there will be a chance to go visit the mock injection site in little groups later and get a guided tour. We thank the media for coming to our event, and we want to reassure that we have people representing different perspectives who are willing to speak with you directly after the event. Requests for interviews can be arranged through Peggy Taillon, who was the first person here to come to the mic. Where is Peggy? Here she is, where the refreshments are. We know that today we are going to hear about difficult issues, about death, about overdoses, about the impact of disease and addiction on the lives of our citizens, about safety in our neighborhoods, about living in community where there is public drug use. If anyone feels upset in the proceeding today, we have people available to provide extra support. Those who are here to provide support are wearing ribbons, I believe.
We have purple name tags.
Purple name tags. It says support. Client support. And it is now my pleasure to introduce our first speaker, Rachel Bard, who is CEO of the Canadian Nursing Association. Welcome, Rachel.